transition is about moving from children's care to adult care, and I thought it would be helpful if I gave you some tips. Transition's a bit like starting a new school. It's a big deal and it's scary, but once you're there, you become comfortable and you realise that you're in the right place.
Transition is a process of getting ready to transfer your care to adult services. You can't stay a baby forever, and you don't want to. We've all had lots of transitions in our life, like moving from primary school to secondary school, maybe moving home. And although at the time it may seem strange and unfamiliar, when you look back, you couldn't imagine it being any different. When your care is transferred to adult services, it means coming to adult clinics and wards if you have to be admitted to hospital, instead of the children's wards and clinics that you may have grown up with. Getting ready to move into adult health services is a process that takes time and preparation. But don't worry, there are plenty of people around to help support you with this. So how do we help you get ready to transfer your care to adult services? Well, you should have the opportunity to meet your new adult doctors, nurses, therapists and anybody else involved in your care in a special transition clinic. With any luck, you'll be able to come back to this clinic more than once, and that gives you time to prepare. Janet, hi, come on in. I'm just going to see Janet on her own and then we'll invite you in when she's ready. Is that all right?
You do get the chance to talk to a member of the team without your parents or carer, so you can ask them questions that you might not want to ask in front of your parents. You can bring a friend if you want, like a close friend of yours. I found it a bit scary as well because I didn't really know what to expect. You're gonna have to talk to them on your own anyway, so I think it's nice to get used to it now. It will prepare you for the future.
Welcome back to the Transition Clinic. The purpose of this clinic is to help you get ready to transfer your care to the adult services.
My mum found it a bit hard because she loves being in control of booking my appointments and monitoring my medication and stuff like that. So she kind of found it a bit hard when I took control.
If you don't get offered the chance to speak to your medical team without your parents or carers present, it can be really helpful to ask for this chance. This means you can discuss things that you wouldn't necessarily feel comfortable talking about in front of your parents.
Because you're older, your doctors don't really need to talk to your parents about what you guys have discussed in the meeting. So you can talk to them about things like drugs and alcohol and sex like that. And you don't have to be shy or stuff because they won't tell your parents because it's confidential.
You have the right to confidentiality, and what that means is that you can talk to your doctors and nurses about anything you like. They won't have to share that with your parents or carers. But we would have to tell someone if we thought that you or somebody else was at risk. Legally speaking, you can consent to treatment from the age of 16, or before that if you're deemed competent by the medical team.
In the transition clinic, you would meet your doctor that you have now and your adult doctor that's going to be taking care of you. You also get to meet members of the adult team, therapists, nurses, doctors. They'll normally give you like questionnaires to fill out, and then probably give you like a booklet with information in it to help you to feel like more confident about moving on to adult care.
Some of the differences between the children's and adult services might be that when you're admitted to an adult ward, they might be bigger. The nurses may be looking after more patients, and they may be less fluffy, shall we say, than the children's nurses. People may not know you as well because they haven't been looking after you for as long as we have in the children's services, and they may not know your name, but that doesn't mean that they care any less.
How's your pain?
It's good.
You let me know then if you start to get any pain and we'll get you something for you.
You may find that you need to tell people more what you need.
Can I get you anything at all?
Can I have some water, please?
Yes, of course you can. Let me go and get you some. How's your
So I think the visiting hours in adult section is limited and your parents can't stay with you, so you've got to stay overnight by yourself. Come prepared with your phones, tablets, books, iPads, whatever, because there's not much to do at all.
It can really help to see the departments and wards before you have to use them. So maybe see if you can get a tour of the A&E or the adult wards. If you need to take medicines regularly, it's really important to figure out how to organise this. If you don't know how to organise this, then now's a great time to have a chat to whoever does, to find out how to get more medicines from your GP or from the hospital if you're running out. And please, please, try and get them before you do run out.
Me, I'm very forgetful when it comes to like taking my medication. You need to start taking responsibility and handling your medication yourself, so you never run out, and always get your repeat prescription before you run out.
You might have been really young when you started getting medical treatment and being seen by doctors. You can't remember everything from that long ago, so it can be really helpful to talk to your family about your condition and how it affected you when you were younger. This is really important because at some point you have to talk to doctors and nurses about that by yourself.
Sometimes you need to read about your condition or ask any family members or the medical team to give you some leaflets about your condition.
It's really important to understand your condition well, in case you have to explain it when you're in pain or unwell.
Don't forget to bring your transition papers to all your transition clinics. Transition is about growing up and moving on in your life. Advice I would give to my younger self is to not be as scared and to take more control and be a bit more independent and not rely on my mum to do everything. Also, it might seem like a lot to take in and that you're never going to get through it, but people want to help.